Hello everyone, allow me to introduce myself. I am Cendrick Abenoja and today I am going to demonstrate the LEOPOLD'S maneuver. LEOPOLD'S maneuver is a way to determine the position of a fetus inside the uterus by touching the abdomen by the hands. These methods is expected to enable expectant mothers to perceive the fetal position and simulate the awareness of child presence. Prior to conduct the procedure, we need to prepare the following equipment: a pillow, a towel, and a stethoscope. Next, we need to perform hand washing to protect my clients and myself as well from infection and cross-contamination. So, good morning ma'am. I am Cendrick Abenoja, your student nurse working with you today. And may I see your wristband ma'am? And please state your full name and your birthday please. Okay, thank you. How would you like me to call you? Okay, ma'am. So today, we will be doing the LEOPOLD'S maneuver. It is a method which we can determine the position of your baby inside your uterus. So later on, I am going to palpate and feel your abdomen and add a little bit pressure so that I can feel and determine where is the position of your baby. Is it okay with you, ma'am? Okay, thank you. Would it be fine, ma'am, if I'm going to close the door and curtains for your privacy and no one from the outside will disturb us while doing the assessment? Okay. So, before we formally begin, ma'am, the procedure, I am encouraging you to void first so that later on you won't feel uncomfortable. Ma'am? Okay, are you done voiding, ma'am? So, okay, I need you to lie down, which is the supine position, with one pillow under your head, and slightly flex your knee. And I need you to turn to your side so that I can place a towel underneath your hip. So, okay, ma'am, can you please turn to that side? Okay. So, a flex knee would relieve the tension in the abdominal musculature, and placing a towel beneath the patient's hip will displace the uterus of the inferior vena cava and aorta, thus preventing supine hypotensive syndrome. Okay, let's start. I'll be exposing abdomen, which is the area of examination, and if right-handed, stands at patient's right, facing the patient. And now I am going to proceed with the first maneuver, which is called the Fundal Grip. Now face the patient and palpate the uterine fundus to determine what part of the fetus lies in the upper part of the uterus. So, okay ma'am, I'm going to expose your abdomen. Okay. So next, I am going to do the second maneuver, which is called the Omnical Grief. What I need to do is to palpate downwards on the lateral uterine surface to determine the position of the fetal extremities, fetal ducts, and apply a gentle but deep pressure. So, okay. So let's proceed to the third maneuver, which is called the pelvic grip. And to do this, I am going to place my hands over the symphysis pubis and grasp the lower uterine segments between the thumb and fingers to feel the presenting part. So I am going to press this, ma'am. Now, I am going to proceed with the fourth maneuver, which is called the pelvic grip. This is done to determine the findings to the third maneuver and determine the presenting part that is in the hypogastrium of the mother and also determine the cephalic prominence. So, if prominence is at the same side of the fetal extremities, then the head is flexed. But if the prominence is of the same side as of the back, then the head is extended. Okay, now that we are done with the maneuvers, we are now going to locate and listen for the fetal heart tune. Okay, ma'am, that we are done with the palpation of your abdomen. Now I am going to listen for your heart, baby's heartbeat. Okay. Locate the fetal heart tune and listen for at least 1 full minute. Okay, ma'am, we are done with the procedure. I am going to cover your abdomen now. So you can sit. Are you now comfortable, ma'am? Okay, thank you. As I determine that your baby is at your right side and your baby is in cephalic position, which is the head of your baby is in lower part of the uterus, which means that kind of position is normal for delivery. And I was listening for your baby's heart sound. I have counted it. It is 125 beats per minute, which is normal. Do you have any questions or concern, ma'am? Okay, ma'am, I would like to inform you that all the information gathered in this assessment will be kept as confidential between you and me. Thank you for your cooperation in this assessment, ma'am. And lastly, perform hand washing and document the findings. Thank you for watching. Again, this is Cendrick Abenoja from BSN 212V.